where they are communicating. Most of these structures which you have learned in the neuroscience related with the nerves, and because we have just talked about the central pieces of these cranial nerves, they are going to exit out from different parts of the cranium, and then they are going to give different branches, and they will reach their target organs. So it's important to understand, how the skull is morphologically oriented, and how different foraminas or the openings in the skull are communicating to which parts of the head and neck region. So the idea here is to talk about the major bones of the skull, because skull is made up of multiple bones. We are also going to talk about different parts of the different bones of the skull, and we are going to talk about mainly on the foraminas and their communication, and what actually is transmitted from these foraminas into different parts of the head and neck region. So unless you have a good orientation of the skull, it is going to be difficult to understand the head and neck region. Once you grasp the orientation of the skull, then it becomes easier. So I don't expect that in one lecture you would be, oriented with the skull, but you need to go into the lab, pick up the skull, look at the different parts, look at the foraminas, take a wire and pass these wires through the different foramina and see where these wires are leading into, because that will help you to make that concept of orientation which is required. But what I can do is a 2D thing here, but what you need to do is, hold the skull in your hand, take a wire, pass the wires through different foraminas and see where they are leading into, because that's what is going to be important when we are going to talk about the cranial nerves, their branches, and from which foramina they are passing through, the different vessels which are passing through different parts of the head and neck. So the most difficult part in the head and neck is the orientation of the skull. Once you have that orientation, then it becomes easier. It is just like having an orientation of perineum. Perineum is a small space, and you start to, you cannot make out a 3D picture of it. And similar is with the issue with the skull. Unless you hold the skull, see different parts, take a wire, pass the wire through different foraminas, it would be difficult to grasp the concept. Okay, so we'll start with the introduction of the skull, and we have two parts of the skull. One is called the cranium, and the other is the facial bones. The cranium includes the skull cap, which is called the vault or calvaria, and you have the cranial base, which forms the part of the cranium. So cranium has two parts: the cranial vault and the cranial base. And then the second set of the skull is the facial bones, which includes the maxilla, the mandible. These are the facial bones which form the face, which are also the part of the skull. So you have calvaria, you have the base of the skull, and you have these facial bones which are going to form the skull. So when we study the skull, we usually study the skulls in different views. So you see the skull from the front, so you call it norma frontalis. When you see the skull from the lateral aspect, or the lateral view, it's called the norma lateralis. When you see the skull from the back, it's called the norma occipitalis. And when you see the skull from the base, it is called the norma basalis. So norma frontalis, lateralis, occipitalis, don't get confused if you hear these terms or read these terms in your textbook, because this just means the views. So you have a frontal view, you have a lateral view, you have an occipital view, and you have a view from the base of the skull. The view which you are seeing in front at the moment is the frontal view, or norma frontalis. And what you see here is this big bone, which is called the frontal bone. And this frontal bone has several parts, because it has a process which is going and having a suture with the zygomatic bone. So this is the zygomatic process of the frontal bone. bone. This is a nasal process of the frontal bone, which is going to articulate with the nasal bone, and this is the maxillary process of the frontal bone, which is going to articulate with the maxilla. So this is the maxillary process. This is the nasal process, which is basically articulating with the nasal bone. You can see the supraorbital arch here. So this is the supraorbital arch, which is making the upper margin of the orbit. You can see a foramen here, which is called the supraorbital foramen or supraorbital notch. Sometimes this is a foramen, sometimes this is a notch. It transmits supraorbital nerve and vessels. Supraorbital nerve are branches of the ophthalmic division of trigeminal, and supraorbital vessels are branches of the ophthalmic artery. The supraorbital artery is a branch of the ophthalmic artery. Then you can see a suture here, which is going to have an articulation of the frontal bone with the parietal bone, and similarly here you can see the frontal bone is articulating with the sphenoid bone. There is an air sinus here which is present, which is the frontal air sinus, and that frontal air sinus, it can get inflamed in certain conditions which will lead to frontal sinusitis, and usually the patients come with the headache, complaining on the headache on the arches of the orbit here, because this is the place where the frontal air sinus or the frontal air cells are present. Next bone which you are seeing here is the zygomatic bone, and this zygomatic bone is the cheekbone which you have. And this zygomatic bone has a process which articulates with the maxilla. It has a process which is going to articulate with the frontal bone. It has a process which articulates with the temporal bone, forming the zygomatic arch. So you have a frontal process of the zygomatic bone. You have the maxillary process, an orbital process, and a temporal process of the zygomatic bone. You can see these two foraminas here. One is called the zygomaticofacial foramina. The other one is called the zygomaticotemporal foramina. They are going to transmit the nerves of their name, zygomaticotemporal nerve and zygomaticofacial nerve, which are branches of the maxillary division of trigeminal. Then zygomaticofacial and zygomaticotemporal. So zygomaticofacial nerve and zygomaticotemporal nerve, these are branches of the maxillary division of trigeminal. Then you can see this bone, which is the maxilla, the purple bone which you see. It has a frontal process, it has an orbital process, it has a zygomatic process, and it has an alveolar process. So alveolar process of the maxilla is giving rise to the upper teeth. Then you have the frontal process, which is merging with the frontal bone. It has an orbital process which is forming the floor of the orbit, and it has a zygomatic process which is articulating with the zygoma. So zygomatic process is here. This is the orbital process. This is the frontal process, and this is the alveolar process. And you can see a foramen here which is called the infraorbital foramen, and it is going to transmit the nerve and vessels of the same name, infraorbital nerve and infraorbital artery. Infraorbital nerve is a branch of the maxillary nerve, and infraorbital artery is a branch of the ophthalmic division. It's a terminal branch of the ophthalmic artery which enters into the orbit. So maxilla also has air sinuses here. So you have the maxillary air sinus here, and then you can see it is forming the floor of the orbit, and it is also forming the alveolar processes of all the upper teeth. So it's an alveolar process which is giving rise to the upper teeth. It has an orbital process which is forming the floor of the orbit. It has a frontal process which is going towards the frontal bone, and it has a zygomatic process which is articulating with the zygomatic bone. The foramina which you see here is the infraorbital foramina, which is going to transmit infraorbital nerve and infraorbital artery. Lower down you can see this bone, which is the mandible, and the mandible has the alveolar processes for the lower teeth. You can see a mental foramen which is going to transmit a mental nerve. So this is a mental nerve which is going to come out from here. It's a branch of the inferior alveolar nerve, and you have a mental artery also coming out, which is a branch of inferior alveolar artery. In the center you can see this is the nasal bone, and then you can see this orange bone which is the perpendicular plate of ethmoid, and this lower bone which is the vomer. And on the side, in the lateral wall of the nose, you can see a bulging here which is called the middle concha, and this bulging which is the inferior concha. The middle concha is a part of the ethmoid bone, and inferior concha is a separate bone itself. If we go to the base of the skull, you are going to see an anterior cranial fossa, a middle cranial fossa, and a posterior cranial fossa. So these are the three fossae which you are going to see on the base of the skull. Now let's concentrate on the frontal bone. So the frontal bone, you can see it here in the front. It is going to give rise to the frontal air sinus. We already talked about the supraorbital foramen. But if we look inside the cranium, the frontal bone is going to form these orbital plate. So frontal bone is coming like this, and then it is sending a shelf-like structure forming the roof of the orbit. So it's forming the orbital plate of the frontal bone. This is the orbital plate of the frontal bone, which is forming the roof of the orbit, and it is going to lodge the orbital surface of the cerebrum. So the orbital surface of the cerebrum is going to lodge on the surface of the orbital plate of the frontal bone. So the frontal bone is coming like this, and then it is sending a shelf like this, which is going and forming the roof of the orbit, and it is going to lodge. Yes.
Just can you show us where's the exact level of cut on this section?
Yeah. So if we have this section cut from here. So if we cut the skull from here, so it is forming the roof. So this roof of the orbit is formed by the orbital plate of the frontal bone. So frontal bone is coming from the top like this, and then it is sending a shelf which is going to give rise to the roof of the orbit. So if you are going to fracture the orbital plate of the frontal bone, this means that you are fracturing the roof of the orbit. So now there would be a communication between the cranial cavity and the orbit. If you are going to fracture the maxilla, the orbital plate of the maxilla, you are basically fracturing the floor of the orbit, and the eye can go down into the maxillary air sinus, because there below that is the maxillary air sinus. So what concept which you need to make, the top you have the orbital plate of the frontal bone, in the floor of the orbit you have the orbital plate of the maxillary bone, which is separating it from the maxillary air sinus. If we look at the skull from the back, now we are looking at the skull from the back. So what you are seeing are two parietal bones, and these two parietal bones are joined by this suture which is called the sagittal suture. So between the two parietal bones there is a sagittal suture. Then behind it is the occipital bone. This is the squamous occipital bone. So this is joined by the two parietal bones, and it is forming this suture which is called lambdoid suture, because it's like a lambda. And then you can see on the squamous occipital bone, you can see these lines which are the superior nuchal lines, and then you can see the inferior nuchal line, and this protuberance which is called the external occipital protuberance. Now the superior nuchal lines are going to be important because they are going to give attachment to the occipitofrontalis muscle, which is coming from the occipit to the frontal. So there is a muscle on the top of your scalp which is called occipitofrontalis. So there are two bellies of the occipital part of the occipitofrontalis, and there is one belly of the frontal part of the occipitofrontalis. So this muscle on the top of the scalp is attached to the superior nuchal line. The superior nuchal line is also going to give attachment to the trapezius muscle. So the trapezius muscle which you see as a back is also basically attached to the superior nuchal line, and also there are attachments, important attachments which are there to the external occipital protuberance. Next you are seeing the mastoid process, and this mastoid process is going to give attachment to the sternocleidomastoid. If we look the inferior view of the occipital bone, so you are looking from the base, this is the occipital bone, again you can see the superior nuchal lines, you can see the inferior nuchal line, this is the external occipital protuberance, this is the foramen magnum which is going to transmit the spinal cord, so brainstem is going to end at the foramen magnum and the spinal cord is going to extend below that. You can see the condylar processes here which are going to articulate with the atlas. So the atlas is the first cervical vertebra which is going to articulate with the condylar processes of the skull. In front of the condylar processes you can see this foramen which is the hypoglossal foramen. And this hypoglossal foramen, if you remember, it transmits the hypoglossal nerve, and the hypoglossal nerve is the 12th cranial nerve which supplies the muscles of the tongue. So if somebody gives you a scenario where there is a fracture of the base of the skull involving the squamous part of the occipital bone, which foramina could be affected, or which the fractal line can pass through which one of the following foramina, and somebody writes foramen ovale, spinosum, hypoglossal. So the one which is there is the hypoglossal. So what I want you to concentrate, see which bone and which foramina is related with that. So if you have a fracture line going through a particular bone, which set of foraminas could be affected and which structures could be affected. So keep that in your mind. Okay, yes.
There is another form.
These are the condylar process. This is hypoglossal.
Inferior to the condylar process.
Yeah, this one is condylar foramina, which has no important structure which is passing. There are some emissory veins which are passing, and we don't need to know about that. Okay. Okay. Next one which you are seeing is the lateral aspect of the skull, and what you are seeing here is the frontal bone here. There is a parietal bone here. This is the temporal bone, and this is the sphenoid bone. All these four bones are joining here in a H-shaped suture. Can you make out this?
Yes.
This point is called the pterion, where these four bones are joining: frontal, parietal, temporal, and sphenoid. They are joining at this point, which is called the pterion. And the clinical importance of pterion is that the inner aspect of this has the middle meningeal artery. The anterior ramus of middle meningeal artery is lying just inside the pterion. So if you have an injury to the lateral side of the skull and there is an epidural hematoma because of the rupture of the middle meningeal artery, you need to sometimes perform a burr hole. And the burr hole, the way you are going to find out the burr hole is that you put one finger behind your lateral margin of the orbit and two fingers above the zygomatic arch, and you would reach the pterion. And that is the point where the four of these sutures are joining. The frontal, parietal, temporal, and sphenoid bone are joining to this point, and it's called the pterion. And this is the point which you can easily identify by putting one finger behind the lateral margin of the orbit and two fingers above the zygomatic arch, and you would reach this point, which is the pterion. So this is the site where you perform the burr hole. Now let's concentrate on the temporal bone. So this temporal bone has this part which is called the squamous temporal bone, and then this is the process which is called the zygomatic process of the temporal bone. Then you can see an opening in the outer aspect of the temporal bone, and that is called the external auditory meatus. There are two processes. One is the mastoid process, the other is the styloid process. The mastoid process, if you remember, it gives origin to the sternocleidomastoid. The styloid process is going to give origin to 3 muscles and 2 ligaments. The stylohyoid muscle, stylopharyngeus muscle,